Good evening. My flashcard presentation is on dehydration. Dehydration occurs when there is insufficient fluid because of inadequate fluid intake or excessive fluid loss. This leads to an insufficient amount of water to carry out normal physiological functions. It can range from mild to severe, and if not treated promptly, it can lead to serious complications, particularly in the vulnerable population, such as infants, elderly, and those with chronic illnesses. Let's look at the pathophysiology. Dehydration results from a deficit in the total body water due to either inadequate fluid intake or excessive fluid loss. The body's normal balance of electrolytes is disrupted in dehydration, leading to a decrease in the plasma volume or an increase in the serum osmolarity. This causes the release of the antidiuretic hormones to promote water retention and activate the thirst mechanism. If fluid loss continues, cellular functions is compromised, and this leads to potential multi-organ dysfunction. Let's look at the risk factors. This include age. Infants and older adults are at higher risk due to reduced thirst response, and in the older adults, the potential for decreased kidney function. Chronic illness um, like diabetes, kidney disease, gastrointestinal disorders can increase fluid loss or decrease fluid intake. Environmental factors such as high temperature and humidity can lead to increased sweat and fluid loss. Physical activities. Very intense exercise without taking in adequate amount of fluid can cause significant dehydration. Major signs and symptoms include thirst. This is one of the early symptoms triggered by the body's attempt to increase the fluid intake. Dry mouth and dry skin also is another sign. As the body tries to conserve water, mucous membranes becomes dry. There is decreased urine output. The kidney responds to dehydration by trying to conserve water, leading to concentrated dark urine. Excuse me. Fatigue and dizziness. As the dehydration progresses, blood volume decreases. And we know with decreased blood volume, oxygen in the blood is going to be reduced in the tissues. Because oxygen delivery to the tissue will be inadequate because there is decreased blood volume, which carries the oxygen to the tissues, and this causes fatigue. Rapid heart rate. The body tries to compensate for the low blood volume by increasing heart rate to maintain blood pressure. That is the reason for the rapid heart rate. Let's look at diagnostic testing. Um, Blood tests. We would do serum electrolyte levels, blood urea nitrogen, and creatinine levels to assess the severity of the dehydration. Urinalysis. The urine can be checked to reveal um, concentration because in dehydration, urine is concentrated. So, doing a urinalysis can reveal concentrated urine, which is common sign of dehydration. Specific gravity is often elevated in dehydration as well. Physical examination. This include assessment of skin turgor, blood pressure, heart rate to gauge the extent of the dehydration, as well as checking the individual's weight. Because in dehydration, due to the fluid loss, weight there is a weight loss that goes with dehydration. Thank you.